Morning. Bonjour.
I will call this meeting to order. Welcome to meeting number 28.
Committee on Human Resources, Skills, Social Development, and the Status of Persons with Disabilities, pursuing to the order of reference of Wednesday, February 4th, 2026. 2026, we got... The committee is meeting on Bill C-222. Today's meeting is taking place in a hybrid format. Pursuant to standing orders of the House, members are appearing in person and virtually. Today, all members are in the room. Witnesses are appearing virtually as well as in the room. Before we begin, I would like to review a few points with all those. Members in the room, please remember to silence your devices and refrain when you're speaking from tapping the boom for the benefit of our interpreters. As well, you have the choice to participate in today's meeting in the official language of your choice. If you're in the room, please select the language you wish to participate in using the earpiece. Those appearing virtually, click on the globe icon at the bottom of your surface. Choose the official language of your choice. If there is an interruption in translation services, please get my attention by raising your hand. We'll suspend while it is being corrected. As well, please direct all comments through I, the chair. Wait until I recognize you before proceeding. In the first hour this morning, we have appearing with us as an individual in the room, Lily Hamill, Communications Coordinator, Sophie Munet, Professor, Université de Québec à Montréal, by video conference. As an individual in the room, Alison Venditti, Human Resource Professional. Each witness has 5 minutes for an opening statement or less. We'll begin with Ms. Hamill for 5 minutes or less. Ms. Hamill.
Thank you, Mr. Chair and members of the committee, for the opportunity to speak to you today. My daughter Lyrica died on New Year's Eve in 2021 from complications related to her congenital heart defect. She was 7.5 months old. Lyrica had what we always called rock star hair, and in her short life, she had undergone 2 open heart surgeries, and one was expected shortly after birth, and the second came unexpectedly during a routine checkup. Each time, my husband and I stayed in hospital in Toronto for about a month while she was inpatient. Because this was 2021, during the height of COVID restrictions, visitors were not allowed. Our older daughter, Octavia, who was 2.5 at the time, had to stay with family while we were there. And we were unable to see her during those hospital stays. Octavia adored her baby sister, and she is deeply missed by our family, and her loss continues to ripple through our daily lives. The days and weeks after Lyrica died are not entirely clear in my memory. Like many parents in shock and grief, we are simply trying to navigate what needed to happen next. Which for us was caring for Octavia. Within the week, I had to tell 2 separate people what had just happened at Service Canada. During that conversation, I was told that because my daughter had died, my maternity and parental benefits could not continue as they had been, and I had already accrued a $300 debt. They did explain I could transition to sick leave benefits. However, my employer does offer short and long-term disability coverage that provided higher pay options with much less administrative burden. So we chose that option. My husband's employer offered the same. In that sense, we were fortunate. We continued to have income and job protection during that time. I am very aware that many families do not have that option. For parents who are grieving the loss of a child, They are barely hanging on to routine daily tasks. Navigating new benefit claims, paperwork, or potential repayments during those early days were an overwhelming burden. Seeing that legislation like this has been attempted in the past and at a time that might have been in place before my daughter died makes this issue feel especially important for me. What happened in my situation is something that could and should have been prevented. No parent who has lost a child should have to navigate government paperwork or repay benefits while they are still in the earliest days of grief. Thank you for the opportunity to share my experience and to support this important change.
Thank you, Ms. Hamill. We'll now begin our second witness, Madame Munier, for 5 minutes.
For 5 minutes, please. Mr. Chair, ladies and gentlemen, members of the committee, thank you for your invitation. For the past 5 years, I've been leading a research program on the return to work following a perinatal death, that is to say, the death of a child during pregnancy, childbirth, or the first few weeks of life. This phenomenon affects between 20 to 25% of pregnancies, representing some 100,000 deaths per year in Canada. The scientific research is clear. Experiencing a perinatal death is an upsetting experience that can have significant effects on psychological health of the parents. Studies show that several months after the death, parents still present high levels of symptoms of depression, anxiety, or post-traumatic stress. Our own data collected from Quebec mothers indicate that in the 12 months following the death, 50% of them presented elevated bereavement symptoms, while 30% reach the clinical threshold for a diagnosis of generalized anxiety. The vast majority of parents feel the need to take time off after a perinatal death. In our research, 85% of mothers took leave following the death. This figure rises to 95% in the case of deaths occurring later, starting from the 20th week of pregnancy onwards. It should also be noted that in Quebec, when death occurs after the 20th week of pregnancy, the person who carried the child is entitled to 18 weeks of maternity leave through the Quebec Parental Insurance Plan. In our studies, over 90% of eligible mothers took advantage of this leave. They went on to report greater psychological well-being when they returned to work. On the other hand, mothers who were unable to take advantage of this type of leave either resorted to sick leave, which sometimes involves a lot of red tape, or unpaid leave, which has a significant financial impact, or took no leave at all. Mothers who used these types of leave reported less well-being and more psychological distress on their return to work. These levels of well-being and distress were subsequently strongly associated with difficulties in functioning at work, including concentration problems, lack of motivation, energy, and lower productivity. On another note, for nearly 60% of the mothers we surveyed, the main reason for returning to work was financial, even though they did not necessarily feel ready to do so. In fact, the participants in our studies indicated that in the month following their return, an average of 65% of their time at work was spent when they were not feeling well, either physically or psychologically. This proportion rose to 74% for mothers who were unable to take maternity leave and to 80% for those who had to take unpaid leave before their return to work. Finally, although there is more data for mothers, it's essential not to overlook the experience of the partner, often the father. Studies show that fathers can also be profoundly affected psychologically following a perinatal death. Often placed in a supportive role, many feel less legitimate to express their grief, and their experience remains largely invisible. This invisibility is reflected in the support measures available to them, which are very limited. Most fathers return to work quickly, sometimes immediately or only a few days after the death. They report various difficulties at work, including a loss of concentration and energy. For some, the lack of leave eventually catches up with them a few months later, leading to prolonged absences. The fathers we met in our research indicate that they have to rely on the good fortune of having an understanding employer in order to get the support they need, which creates major inequalities from one person to the next. In short, research results show that following the loss of a child in the perinatal period, the vast majority of parents feel the need to take a period of leave. The absence of appropriate leave or a hasty return to work is likely to exacerbate psychological distress and then have repercussions on functioning at work, which necessarily entails significant costs for workplaces and the society at large. The example of maternity leave offered in Quebec to mothers in the event of late perinatal death illustrates, however, that a uniform and accessible measure can help foster a healthier and more sustainable return to work. Our research work therefore leads us to recommend the presence of paid leave for all parents experiencing a perinatal death. In addition, parents already on maternity, paternity, or parental leave at the time of death should not have their benefits interrupted. In this sense, our research data strongly supports Bill C-222. Better support for parents experiencing a perinatal death has many benefits, both for the parents by enabling them to recover adequately, and for workplaces by ensuring that employees function better when they return, as well as for society at large by reducing the significant costs associated with mental health disabilities. Thank you for your attention, and I'd be happy to answer any questions you may have.
Merci, Madame.
Thank you.
With Ms. Venditti. Venditti? You have the floor, Madame, for 5 minutes.
I just wanted to start by saying thank you to the chair and to the committee for having me here today. My perspective is going to be a little different than ones you've seen from other people. My name is Alison Venditti. I'm a certified HR professional and a certified HR leader. I have over 20 years of HR experience in most industries, from logging to manufacturing to retail to healthcare. I've seen most different programs that have been rolled out. In addition to recruitment and retention, I have and will continue to develop leaves programs. So my expertise lies in short-term, long-term, and parental leave. I will say that helping someone go on maternity leave is one of the highlights of my job. You get to have a party, everybody gets excited, we hire a replacement, and we wait with bated breath so that we can send that email to everybody when they tell us the baby's here. If that part is the highlight, I will tell you that having to get the phone call from someone that they've lost a baby is the exact opposite. Getting that phone call and having to let the team know, people who you've worked with for 20 years know, and then everybody saying, what do we do? And we don't know. Supporting someone who is grieving, but also having to navigate where they fit in is very difficult and is not something that HR has the power to do. Helping someone decide whether they go on sick leave benefits, how they want to manage it, even if they call us, is not something that we're able to do. As an HR professional, I can only guide employees. And many workplaces, and I'm glad to see Ms. Hamill's workplace has short and long-term disability. Many places do not. That is not an option for a lot of employees. So currently, when someone loses a baby, as you've heard, they're removed from maternity leave and asked to move to EI sickness benefits. For many people, that involves having to go in person to a Service Canada location. Phone calls, reporting, answering questions, updating your employer, not knowing if you're going to be accepted onto these leaves, and then having to report every 2 weeks why you are still on sick leave benefits. Having to tell someone every 2 weeks that your baby has died is completely unnecessary and cruel. If the paperwork isn't done correctly, the employer has to try and coach the employee. If it isn't done, we have to make a phone call to them to say they're no longer on approved leave, and we have to figure out how to bring them back. The replacement has questions. Managers don't know what to do. Nobody knows what to say. I have spent dozens, more than dozens, hundreds of hours trying to make sure that our valuable employees continue to feel value, that this works for them, and that they indeed come back to us, which is what we want. This bill fixes that. Pure and simple, it fixes that. As a bill for parents, it's the right move. As a bill for employees, it's the right move. And as a bill for employers, I'm telling you, it is the right move. I want to spend my time making workplaces better. I want to spend my time making workplaces more efficient and more human. And this bill will let me do that. Thank you.
Thank you, Ms. Venditti. We'll now begin the first round, which are 6 minutes with Ms. Falk. Ms. Falk, you have the floor.
Thank you very much, Chair, and to our witnesses, thank you. Ms. Hamill, thank you. I know it takes courage to come to committee to begin with, let alone to be vulnerable. I want to thank you for being willing to be so courageous in such a vulnerable time, because it's every time you share your story, you are being re-victimized in a way, right? And it brings up raw emotion. I'm also so sorry that this happened all during COVID. I had a baby in 21 as well, and ended up having to, I'm in a very rural riding and had to be airlifted and flown to the nearest hospital, which is 3 hours away. So I had some experience in the neonatal center, I guess, during that terrible, terrible time of not being able to go in. You can't even touch your baby. Like, I am so sorry that that was the experience that you had to navigate through and navigate in a very lonely place. I'm also very sorry as well for the experience that you had to go through with Service Canada and go to a very bureaucratic, administrative place, which Ms. Vendetti is probably familiar with, that isn't necessarily understanding, warm, friendly, or compassionate. So I, like, from mother to a mother, I'm sorry, but I am so thankful that you have come here to share your story. I spoke a little bit about this. I don't know if you're following the proceedings at all, but at the last committee with the Cormiers, I had the privilege, MP Richards had a motion a few parliaments back, actually, that was to study this exact issue. And I had the opportunity to be on this committee at that time to study this issue. The committee very much had robust recommendations. I was shocked at the stuff that I was hearing. I mean, one of the quotes that the Cormiers said has literally shaped me as a parliamentarian, and the compassion that needs to be administered at every level of government, especially when we are here to serve the people and the departments are here to serve Canadians. That needs to be, and so that's something that has really shaped me. So I just want to emphasize the importance of sharing your testimony, sharing your story, because it matters. I will note that when we did do that study, this committee had a recommendation. We had several recommendations that we had then sent to the government. The government then had a response. So the government has actually known about this, like these situations, for a long time. They tabled a response on June 7th in 2019. So that was a long time ago, right? A long time ago. Would you say, in your conversations, even with other parents that might be in a similar situation, would you say that their experiences with Service Canada would be similar to what yours was?
I would agree. It's been tricky. I was lucky the people I did speak to were more empathetic than Ms. Cormiers. But I did obviously overwhelm the first person I spoke to. The second I said my child had died, I could tell there was panic on the other end of the line, and she went to go get someone else. So then I had to go and re-explain the story. I knew I needed to tell them. It was then you have already accrued a $300 debt.
Right.
That was the hard part.
And then you had to pay for that?
I did.
You had to pay for that. And then so when you did that, was it just, here's the money, or did they deduct that from if you were receiving child benefits from another child,
I think they would have deducted it, but I just paid it back in order to be done with it. Everything in that time was like, whatever is the quickest, fastest, easiest.
Just to get it
just
over
to
with.
get it off my plate.
Okay, and then your afterwards, were there any issues, or that was kind of it?
That luckily was it for
Okay.
us. It was my HR, my work was very easy to get us onto the short-term disability, same with my husband.
Okay, yeah. I know when I do look at the report from the government at the time in 2019, the Liberal government, the report does specifically mention that parents could access other benefits instead of looking at a bereavement leave. So, again, I'm so sorry that we're doing this again. And that this is, but you know what, I very much hope that your story and your experience, and I know it's not for naught, and that your experience and you sharing this information and your story is going to make a difference. And this, at the end of the day, this bill has to move forward. The government needs to give it a royal recommendation so that we can help families like yours, because there are others. We learned the other day, 1,600 additional a year, right? And so any way that we're able to make life better for bereaved, grieving parents and families, that matters. So again, I just want to thank you so much for sharing your story and your testimony today.
Thank you, Ms. Falk. Madame Koutrakis for 6 minutes.
Thank you, Mr. Chair, and thank you to our witnesses for appearing before us today. Thank you for sharing your very personal and tragic story, and my sincere condolences. I'm a parent and a grandparent myself. I can't even begin to imagine the pain that someone goes through losing a child and then having to fight or go through the bureaucratic process. So in many ways, I share my colleagues' comments with regard to we need to do better. And we're hoping that with the passage of this bill, this is exactly what we're going to be doing. There is no question that more training is needed. I used to be in the finance industry, and I used to, lead teams of 200 people or so. And dealing with finances is not always a very high emotional IQ area, because you're dealing with people's wealth. So one of the things that I made sure that, people that I was leading is that they had the adequate training that they needed to deal with such sensitive issues and to be more human and to be very mindful of the questions that were being asked at the appropriate time. So my sincere apologies that you had to experience that, and apologies to any parent that has had a similar experience. And we're hoping with this bill we're going to do better. Based on your experience, do you feel the amount of leave proposed in this bill would provide parents with meaningful time to process their loss, or do you think additional flexibility might be needed?
I'm actually not sure how much time is proposed in the bill. I know personally I was off around 11 months, and my husband was off for longer. He works in emergency services, so his work was more triggering to hear those phone calls.
And did you find that the amount of time and the understanding that you received from your employers was meaningful and something that really made a difference for you at the time?
It was. My employer was so easy to work with. They helped me work in a step back program, so I didn't return to full-time work immediately. Stepping back into the real world was wildly difficult. You felt you were being looked at. You felt very other than everyone else. And while I still don't know who knew what at what time when I returned to work, there were new employees who I didn't know from when I went off. So it's weird, and you don't want to bring up this landmine that now you're caring for someone else's shock about my own personal life, which can make it hard. But you also don't want to not mention your child because they were there and they've shaped who I am. So it's a weird spot, and having a little bit more distance from the day really did help. Practice talking about it and getting used to this new life.
Venditti, from an employer's perspective and being in HR, having heard this testimony, How do you think that this bill addresses some of those issues that would help employers to deal with this type of situation better? And in your opinion, what more could this bill be addressing with regard to how employers should handle such very difficult issues?
I think this bill does a wonderful job of addressing the very real issue that we have to deal with. And unfortunately for me, Ms. Hamill's testimony, I've done this for 20 years. I can't count on all my hands and toes how many times this has happened. So it is not it's not a one-off. I think the bill does a wonderful job. This is exactly what employers would want so that we can focus on our employees and focus on being great employers and focusing on making sure that our employees have that experience where they say, my employer was there and they were great and I'm happy to come back and they did everything they could. So if we're not doing all the things that I mentioned and trying to help them figure out where Service Canada is, then we can focus on making this experience better for our employees. So I don't think there's anything else this bill could do other than the very wonderful and real thing that it can do for a lot of families, which is stop this bureaucratic nonsense.
Thank you. Et Madame Meunier, est-ce que vous pouvez
Ms. Meunier, would you like to add your comments with regard to the two questions I have asked to Ms. Hamil and Ms. Venditti? I think it would be really helpful for us to have your comments on this subject because you've done some research in it. How can we craft this bill and make it better for parents? Thank you very much. Well, the testimony we heard this morning aligns with what we heard in our research project. We talked to hundreds of parents, and it's all about getting some rest and recovery time. And of course, it's a difficult period, and the people are having to deal with burdens and cumbersome government paperwork processes. And these are people who are already in a tough situation. So it's not just a one-off. It's really generalized in terms of the parents we have spoken to. In Quebec, they do have access to parental leave that kicks in these cases, but there's a lot of variation from one workplace to another. Some people are lucky and they have employers with more flexible and advantageous and more comprehensive conditions, and sometimes there are friendly solutions that are also reached with the employer, but it's not everyone that has access to this kind of situation, so it's quite not equal across people. So the bill would make it more uniform across everyone. And something we saw in our research, sometimes it could come in handy, is that this leave could be flexible in terms of the time, but the timing as well when people choose to take the leave, because bereavement is not just linear. It doesn't linearly go down for everyone or anyone really. So it might have to do with the birth date of the child in question, and sometimes maybe having the option of breaking the leave into chunks and using it at a timing of the choosing of the parents. That could be an element that could be added.
Tracus, Madame LaRouche.
Ms. LaRouche, for 6 minutes. Thank you very much, Chair. I would like to thank our witnesses. We are hearing different points of view today, HR, research, and your very human point of view, Ms. Hamel. I'd like to offer my compassion and sympathy to you. My daughter was born during the pandemic, and I think there's some research out there on pregnancy and bereavement in this period that just added another layer to everything that was happening, and people ended up going through their rituals to get through it all, to take care of themselves, which wasn't easy at all in that context. So thank you very much for your courage and for keeping up the fight. I think you're doing this in memory of your daughter, and you've done a great job of conveying your experience to us. We really have all felt it. So you said that you didn't know about the length in the bill that is envisaged. Our researcher here also referred to it. In Quebec, for instance, the Quebec Parental Insurance Plan has 18 weeks. So this is a more comprehensive reform of the Employment Insurance Act to make it more humane, more compassionate, and more feminist, because it's most of the time women who are being penalized. They're discriminated against because they do not have access to EI benefits because they have simply not accumulated the number of weeks, for instance, or the plan isn't as flexible and as understanding given the situation. Our former colleague Louis Chabot wanted to have this reform to the EI system done. Now, do you have other recommendations, other suggestions, a number of weeks, other useful tools, things we should be mindful as lawmakers when we're dealing with this bill? What could be added? What could help parents, in your opinion?
Just listening to the other witness mention how having the leave potentially be able to be chunked out to different times could be very helpful. As I said, I was off for about 11 months, which meant I went back to work about a month before the death anniversary of my child, which coincides with the holiday season, which is already a hard time for bereaved people. And since I'd returned back to work, I then had to embark on a bit of a struggle with our long-term leave supplier that I would need the week surrounding New Year's Eve off in addition. And they did not really quite understand how returning to work after a difficult holiday season on January 2nd might be difficult. My therapist got involved and was able to ensure that I just stated I would not return to work until after that time unless we would have that time off. There are other milestones, like for me, because her birthday and her death date aren't significantly close together. She lived 7.5 months. Both of those times are difficult, and I continue to use my vacation to not be at work for those times. So that might be something that could be included.
Merci.
Thank you. Now, to go back to this question of 18 weeks, Ms. Meunier, you referred to it it's for QPIP, the Quebec Parental Insurance Plan, that this plan has 18 weeks, and parents have access to this period of time. And you also referred to dividing it up into different chunks as an option. Now, could this period of 18 weeks be an example for the federal system? Should we be thinking about more or other things? Because you provided a lot of numbers, Ms. Meunier, in your opening remarks. Should we expand the bill to take into account other realities, recomposed families, children who are adopted? Should we be thinking about other things? Well, you're right. It's quite challenging to establish a number for the duration of this leave because there's a lot of variation from one person to another. But one thing that is certain is that people who have access to these 18 weeks of leave have really appreciated it. And in our data, we see that these people have higher scores when it comes to psychological well-being at work once they are back at work. So we are seeing that the 18 weeks actually work. I mean, could it be more in some cases? In some cases, after the maternity leave, mothers asked for sick leave because they were not ready to go back, or we had others who did not use the whole 18 weeks and went back to work earlier than others. So it varies a lot from one person to another, but the 18 weeks seem to be a good middle ground. Now, the issue in Quebec is that partners or fathers, the individual who did not carry the child in any case, isn't considered in this type of leave. And so they need to take leave without pay or other types of leave, as we talked about. So it's really important that the bill take into consideration both parents. And I don't know if this is something that the bill can achieve, but we need to raise awareness in the workplace with regard to bereavement, perinatal bereavement, loss of a child during pregnancy being included in that. So it's still a bit of a taboo subject in different organizations. Now, people have a lot of compassion. They want to do the right thing, but they don't know how to approach this and support employees in this situation. Now, a progressive return to work could be an option. Now, during the pandemic, of course, we had many difficulties, but maybe a positive in that period was that people were saying that they appreciated being able to work from home or work remotely because they were going through more intense emotions and they were able to take a break. They were home, not in front of or amongst all of their colleagues. So having that flexibility is also something. Now, this might not be the primary objective of this bill, but maybe we could do some awareness-raising work. Thank you, Ms. LaRouche.
Seaback for 5 minutes.
Thank you very much, Mr. Chair. Ms. Hamill, I'm so sorry. I lost a child in childbirth. It is unbelievably devastating. You never get over it. January is always a terrible month for me. I think this bill, I didn't have to go through what you went through. My wife at the time had great benefits at work, so she had her mat leave benefits through work. I think the challenge that we have with this bill is that, and I think it's something we need, and I think everyone here agrees with that, is because this bill will require the government to spend money, it needs something that is called a royal recommendation. And the members on this side are not able to do that. Only the government can give a royal recommendation to a private member's bill if it's going to cause the government to spend money. I take it that you would think it's very important that the government give this recommendation. I would ask all the witnesses if you would agree that that would be an important thing because of the value it's going to provide to so many people.
Yes, I would agree.
Yeah.
Absolutely.
Yeah. Well, look, I hope the government's going to get there because if you haven't gone through the suffering of losing a child, you can think you understand it. You can try to understand it, but you actually cannot. It's debilitating. I still remember when it actually felt like my heart physically broke. I actually felt like there was a crack. So I hope that we'll get this done because I think it's so important. And I hope that we can get the royal recommendation. And Mr. Chair, I don't have any other questions.
Did you want to share your time with
Ms. Goodrich?
Thank you, and I want to thank you, Ms. Hamill, for sharing. Like you, I had a baby during COVID, and that's a complicated space to begin with, especially with all of the pieces. And very similar to Ms. Falk, I then had my second baby, and it was early, and there were complications, and so we had to get airlifted out and go to another community and kind of navigate that. And my experience being in a NICU was the first time I'd really fully considered the fact that there were babies dying around me and there were moms dying around me, and there were things that I had never really contemplated because my first baby was very healthy, so very similar to your Octavia, so that wasn't even something that would be in a brain. And it was really heartbreaking to me to be in these NICUs and hear some of these stories and contemplate some of the challenges these people were going through. And so I just want to sincerely thank you for being brave and telling this story and letting your daughter's legacy build something spectacular and letting your loss be part of, hopefully, fixing part of this problem for someone else. And so my question to you is there anything you'd like to share with us about your daughter so that when we're looking at this bill and we're looking to vote on this, we can think about some positive memories of your daughter?
What a wonderful question. Thank you. So Lyrica was born with a congenital heart defect. We did know this prenatally, so we were prepared, and I live in Peterborough, so my husband and I moved to Toronto to prepare for her birth. She, as I said, had rock star hair at birth. It was 1.5 inches long, brown, stuck up everywhere. The nurses at Sick Kids continued to smooth it down, where we always spiked it up. And she was big. She was 8 pounds, which was a massive baby for being in the cardiac care unit. There wasn't a single medical professional who didn't come in there and say, wow, what a big baby. And I just joked with them at the time that you told me bigger was better. So here we go. We knew she would require immediate heart surgery, and her surgery went well, and she came back. We were home within a month from open heart surgery. She grew, she thrived, she learned to laugh, she smiled, she interacted with her sister. My daughter loved her baby sister. And she did get to meet some of our family members. Even with COVID, we were very careful on who she got to see and when because of everything going on, and she was severely immunocompromised. She learned to laugh the day we went in for a checkup, which then had us be admitted. Entirely unexpected. It was the first time I went to Toronto without overnight bag. So we were again in unexpectedly at Sick Kids, and she had another heart surgery within a week. Recovery was a little longer this time. It took a little longer to get home, but again, we were home with the idea that she should be good for quite a while. She didn't have a terminal diagnosis. She had a very good prognosis at a 90% chance at a good life, which in my mind isn't a 90% chance of living, it's living a good life. But she developed a complication with arrhythmia, and we ultimately think that's what caused her to die unexpectedly. It was a traumatic night with ambulances and the ER, very much like you would see in a TV show. My husband works for Orange Air Ambulance, which is the airlifting place in Ontario. I don't think either of you are from Ontario, which is why he took longer to return to work. But we had them on standby to try to get her to Sick Kids in time. Peterborough is a wonderful hospital, but they're not a pediatric center. Her life was happy. The time she was home was happy. She spent time with her family. We went swimming. We did the things that you do with your 3-month-old, your 4-month-old. And it was lovely to have her. My daughter still talks about her daily. I do have a new young son. He's 2.5 now. So we are trying to teach him about his older sisters. Yeah.
Suspend for a couple of minutes. Okay. committee members, as you can see, this subject matter impacts people differently. And so we will conclude the first round. And at this time, we'll turn to Ms. Fancy for 5 minutes.
Thank you very much, and through you, Chair. Thank you to all the witnesses that came today. Ms. Hamill, as you were speaking and talking about Lyric, it reminded me, with her rock star hair, reminded me of my own little sister, whose nickname is Spike, for the same reasons. So let's take this now from a policy standpoint, because as parliamentarians, one of the reasons why we want to get in this job is to help further progress for human situations that occur. I'd like to start with Ms. Muner in regards to some of her research. Ms. Muner, I was wondering, from a public policy perspective, how does Bill C-222 strengthen Canada's parental leave frameworks? Thank you.
Merci pour la question.
Thank you for the question. Well, as far as I can tell from the bill C-222, it aims to allow parents who lose a child during any of these leaves to continue to have these benefits and leaves and not have to launch themselves into admin paperwork or other initiatives, or maybe pay back some of the benefits that they have been provided with, as we heard this morning. But of course, these people are not really in a state to do so. They don't have the will or the energy to manage these processes. So the added value in this bill would be to allow parents to live their grief and bereavement without the added financial stress and pressure of these initiatives. That is what I can tell.
Second question to that is, how important do you think that job protection leave under the Canada Labour Code is ensuring that grieving parents can take the time that they need without the fear of reprisal or losing employment? Thank you.
Oui, exact. Donc, en ayant un congé qui est vraiment...
Well, having a federal leave that is prescribed by the government would ensure more uniformity, and it becomes the norm to have access to this leave. So parents are less subject to the goodwill of their employers or having more advantageous conditions in their workplace.
Thank you very much, and thank you for your research on this important topic. I'd also like to turn to Ms. Venditti. Ms. Venditti, are there any amendments that you would recommend for Bill C-222 as it stands at this point?
No, I think the bill does exactly what it's supposed to do, which is, again, wonderful for employers to not have to, support their employees trying to figure out how to make this makes it much easier to just transition while they're going through all this.
Awesome. And do clear federal rules around parental benefit continuation help reduce confusion for employers when employers experience pregnancy or infant loss?
Yes, absolutely. That having to have that discussion with your employee and try and explain and understand, we just remove all of that. That they just continue on, and we're able to support them the best way that we can, which is not trying to navigate Service Canada, but saying, how can we help your family?
Awesome.
Yeah.
Oh.
Yeah.
I have one for you too.
Yeah. Madame LaRoche, to conclude avec...
Ms. LaRouche, to conclude with 2.5 minutes. Thank you very much, Mr. Chair. I'd like to thank once again our witnesses, Ms. Hamel, Ms. Venditti, and Ms. Meunier, for your testimony this morning to help us in our work with regard to this bill. And I hope that the bill will be adopted and get royal recommendation so that it can be implemented, because we're seeing through testimony, emotional testimony today, but in previous meetings as well, we're seeing that this bill needs to be adopted. So, Ms. Meunier, to wrap things off around this bill, I was talking about expanding it to cover recomposed or adoptive families. Should we also be thinking about precarious workers or self-employed people who seem to be excluded by this bill? Should they be included in the scope of this bill as well? Yes, definitely. We've seen and heard from parents that we talked to telling us that they are self-employed, so taking time off or taking leave, it's not something we can do. It doesn't exist for us, so it's an added challenge for people in these situations. So I wholeheartedly agree with the idea of taking parents in the situation into consideration as well. Exactly. Ms. Meunier, from a public policy point of view, are you aware of better international examples that you've been able to observe when we're trying to support parents? Have you had the chance to gain insight into that? Well, there's quite a lot of variation from country to country. I think in Australia there are good measures already in place. They seem to have been introducing more leave for both parents, not just the person who carried the child, so the other parent is also considered with regard to bereavement. As I was saying, awareness raising is also key in the workplace. We haven't talked about that element that much, but this is something that impacts perinatal deaths, rather, is something that impacts 1 out of every 4 or 5 pregnancies. So anecdotally speaking, when I launched my first research project, when I was at work the following day, actually, I had already received 5 emails and 4 people came to talk to me, and they were very happy for this research to exist. So people started telling their stories to me, so we could clearly see that there was an important need and a lack of support for parents. They feel alone, and they are left in silence to deal with their situation. So we really need improved supports for these parents. Now, could it be expanded? We're not just looking into death that can happen after delivery, but also during pregnancy. And we see that a perinatal death, the loss of a child 18 weeks into a pregnancy, while the same psychological distress symptoms exist, whether it's 18 weeks or 21 weeks, or the child is lost, unfortunately, within the first days of their life. So all of that period should be taken into account. And we were also talking about expenditure. Now, this kind of a bill could lead the government to spend money, but we should also maybe talk about the cost of doing nothing, because it leads to functional problems at work, having to undertake administrative steps to enjoy other types of leave. So all of this also has a cost. Maybe this would be a preventive approach, and we could end up making economies.
Madame LaRouche.
Thank you, Ms. LaRouche.
Heartfelt thank you to the witnesses that appeared here this morning. You can see you had a meaningful impact on the committee members. Thank you for your testimony. With that, we'll conclude the first round, and I'll suspend for a few minutes while we transition to the second. Suspend. members, we will resume with the final panel. And since they're here in the room, I'll not go through the notes, but I would like to welcome for the second panel Dr. Francine de Montigny, full professor, Université de Québec en Ottawa, and director, Fatherhood, Family and Society Research Group. From Sunnybrook Health Sciences Center, Megan Faulkner, registered nurse, pregnancy and infant loss network. Each one will have 5 minutes or less for an opening statement. We'll begin with Dr. de Montigny.
Bonjour, je vais parler en français, mais je peux.
Hello, I'm going to be speaking in French, but I could also answer your questions in English. So, Mr. Chair, ladies and gentlemen, members of the committee, thank you for the invitation to speak to you today. I appeared before the HUMA community in 2018, so I'm very happy to see the work being continued. Now, I'm here as a researcher, as a trainer. I used to hold the Canada Research Chair in Family Psychological Health, working on perinatal bereavement for more than 10 years, and I was also a grant holder of the Quebec Research Fund in Health. So I did that work for more than 15 years. So combined, I carried out maybe 25 projects for over 30 years, focusing on the experience of parents or perinatal bereavement professionals. Now, to put perinatal death in perspective, 1 in every 4 pregnancies ends in perinatal death, and my career would have taken a different turn maybe, because at the time it was trivialized, this event, and even today we are having a hard time drawing attention. Now, as I was saying, 1 in every 4 pregnancies ends in perinatal death, whether early, within the first 20 weeks of pregnancy, or late, after 20 weeks of pregnancy. This represents approximately 100,000 perinatal deaths per year. So when you look at the statistics of 100,000 deaths around the time of birth, that's one thing, but we have a tendency to forget the earlier deaths in the 8 to 12 week period. For parents, of course, it's still a baby. Experiencing a first episode of perinatal death increases the risk of pregnancy complications. A 25-year-old woman, for instance, who has an early first miscarriage sees her risk of another miscarriage, stillbirth, premature birth, or an infertility amplified. With every event, these risks are amplified. And yet, despite its prevalence, this phenomenon continues to be trivialized. What our studies over the last 30 years tells us is the following. Men's grief reactions are just as strong as women's, but they're often given little consideration in their experience and relegated to a supportive role. And what about the other parent? We really have very limited data on adoptive fathers or others when these incidents occur. Bereavement symptoms are as high for parents who experienced a perinatal death between 12 and 20 weeks of pregnancy as for those who experienced a later death. Perinatal death and subsequent bereavement have deleterious effects on the mental health of women and men. Up to 5 years after a death, we can still observe depression, anxiety, post-traumatic distress, obsessive-compulsive behavior. And in our study with miscarriages, for instance, in the first 20 weeks of pregnancy, 1 woman out of every 5 had suicidal thoughts after a miscarriage. So it's really serious. 1 woman in 4 received psychiatric treatment in the months following the death. What we also know is that these symptoms of bereavement and anxiety persist during the following pregnancy and even after the birth of the next child, particularly for men who react more after a child who survives. The after effects of a perinatal death on the mental health of both parents are therefore real in the short, medium, and long term. these mental health conditions have repercussions on the children, those who are already in the family at the time of the incident and those who come after, because they're exposed to depression and anxiety in their parents, so they have a tendency to have more mental and psychological problems downstream. So it's a bit of a ripple effect of perinatal bereavement on the entirety of the family. Perinatal death or bereavement also impacts on the physical health of both parents, who may have heart problems, gastric disorders, or inflammatory disorders. The current lack of support, particularly in terms of leave, has consequences for the individual, the couple, the children, and the workplace. Now, what we know is that when parents return to work prematurely, the spouses find it difficult to support each other in their grief, which leads to tensions within the couple. Dr. Meunier's work, who was in the first panel, has revealed that this premature return to work has consequences in terms of being at work but not really being productive, and they have difficulties returning to work and prolongs distress. Now, if I'm not productive with a computer, maybe it's not the end of the world, but if I'm operating heavy machinery and I'm going through some difficult feelings, it could have significant impacts on people around me. Some parents have told us they lost their jobs because their employer felt that they lost their spark, that they were different, that they had changed. Well, obviously. In conclusion, failing to support parents at the time of the event and in the weeks and months that follow the incident is costly for society. In fact, perinatal bereavement has direct and indirect economic consequences that are still poorly understood. Our studies have shown that parents experiencing a perinatal death make repeated use of health and social services at the time of a perinatal death, and to a greater extent in the months that follow, as well as during the next pregnancy. So there are costs for the healthcare system that are not documented. At the same time, the social and family costs, in terms of the psychological impact on children already in the family and on extended family members, are not negligible. For instance, my time is up? Okay. There are also costs associated with mental health problems in the workplace. These have also not been documented, and these are not really well understood. So, to wrap up, a paid benefit for both parents experiencing perinatal death would help them recover from the shock of this incident, which is the objective of the Bill C-222. Thank you. I apologize for the time. I didn't really have anything in front of me.
Madame Faulkner for 5 minutes.
Mr. Chairman, members of the committee, thank you for the invitation to join you today in this very important conversation. I'm here today speaking in support of Evans Law. My name is Megan Faulkner, and I work as the manager for Pregnancy and Infant Loss, or PALE Network. I'm speaking today as well on behalf of Michelle Lafontaine, who is the director of PALE Network, but was not able to be here today. Prior to my work as the manager of PALE Network, I worked as a registered nurse in obstetrics for 17 years, first as a labor and delivery nurse, and then as a nurse in high-risk obstetrics, supporting families through experience of a high-risk pregnancy. During my nursing career, I have had the privilege of caring for families throughout their childbearing years and the honor of walking alongside many as they face the most devastating outcome, the deaths of their infants. I've been in the room when their dreams for the future change in an instant. I've listened to them as they express the depths of their sadness, and I've heard stories about the positive impact of compassion, as well as the negative impact of silence, stigma, and bureaucracy on their grief journeys. In my work with PALE Network, we provide education to health and service professionals focused on skilled and compassionate bereavement care. We have heard from hundreds of professionals that their biggest fear when caring for or working with families is making it worse, either with something they say, a resource they don't have to share, or a discussion about a system barrier that they know the family must face. Such barriers and bureaucracy impact one of our PALE Network volunteers, Kayla, who received a bill of over $4,000 at tax time from receiving benefits after her daughter Frankie died. My colleague Brandon faced barriers when he needed to navigate the system for EI sickness benefits after the death of his daughter Hannah, while battling what he learned later was PTSD from the circumstances surrounding her death. Bureaucracy also impacted Carmen, another Pale Network volunteer, when she needed to go in person to Service Canada to cancel her parental EI leave after her daughter Olivia died. Carmen says, when you're in that kind of grief, dealing with administrative processes feels impossible. It's something no grieving parent should have to face. Evans Law is an opportunity to remove a barrier that we consistently hear is adding to the grief and burden for families. When passed, yes, this bill will change a program process for the better. In addition, this bill will also send a compassionate message to families that their loss, their baby, and their well-being matter. Evans Law will allow people to focus on what matters around the time of their infant's death, honoring them, grieving within their family and community, and choosing for themselves when to return to work. As the government begins this new program for families experiencing infant loss, I believe it will be really important to also think of the process for effective implementation and the funding required to develop the necessary resources and education surrounding the policy changes and supports for families. Pale Network has experience and expertise in these areas and is available to assist the government to scale up additional supports and resources. It would be very feasible to replicate the work of Pale Network nationally, and there is a lot of appetite to do so. The provision of funding would enhance the effectiveness of this bill, and that would help to expand the training, resources, and tools needed to make sure families encounter compassionate responses from those they encounter along their grief journeys, and other supports to ensure they are not grieving alone. Compassion is a core value that I hold within my own professional practice and so important for grieving families. Evans Law is compassion in action. Thank you again for including me in this important conversation. Thank you, Mr. Chairman.
Thank you, Madame Faulkner. We begin the first round, 6 minutes, with Ms. Falk.
Thank you very much for both of you for being here, for the work that you're doing, and for sharing the knowledge and experience that you both have to this committee. It's very much appreciated. Dr. de Monginty, you brought up some interesting statistics. You know, the fact that 1 in 4 pregnancies can end in a miscarriage, is ending in a miscarriage. And there is, and I think something that we've experienced today, definitely, just with the previous hour of testimony that we had, that grief affects everybody differently. And grief comes in waves, right? But this is something that is not talked about. And there's very much a stigma around this. I know even just talking to friends of mine or family that have lost babies. And do I have agency? Am I permitted to talk about the baby that didn't make it? Because there's this weird stigma. What do we need to do as a society and as a culture to help destigmatize this so that once people work through their own emotions and their own process with that, but be able to have these conversations to help destigmatize the loss of a child?
We've been working in Quebec for the past 2 years on producing documentaries and infographics, one-pages, for the population to make it known what parents experience after a miscarriage, what they experience when they're navigating the health system, what they're experiencing when they're returning to work with Dr. Meunier. And we were funded to produce the documents, but there was no money to make a campaign in society. And I think that's what we need. Like when on a des campagnes de sensibilisation.
We have awareness-raising campaigns for suicide, mental health.
I just didn't know the word for campagne de sensibilisation in English, but we have campaigns for prevention of suicide. We have it for different when you're driving, drunk driving, don't drink, or when somebody's told about cancer and how it hits the family, and you see those pictures and it really strikes you. And I think we need to do that nationally to make it known that parents who experience a miscarriage or later on pregnancy death, it's a real baby. And even though it's 6 weeks old, I've seen embryons that were 9 weeks old, and you can see everything of the baby. You can see the eyes, you can see the shape of the head. And for the parents, that child is already 1 year old. It's already in school. They already have plans. So as soon as they know they're expecting, they're already seeing themselves as parents. So it's all those dreams that they have to grieve.
Point two about that it's not just the mother as well. That's everybody around, everybody who knows, everybody who would have been a part of that life. How about for you, Ms. Faulkner? Do you have anything to add for that about the destigmatization?
I agree. I think awareness raising is so important. We know that there's stigma. This is what families tell us all the time happens when they receive care at the hospital, after the fact, and in their own lives. So I agree that the development of resources, awareness campaign, at Pale Network, we do some advocacy around Pregnancy and Infant Loss Awareness Month in October. We have a walk for families, and a lot of these are to help families feel like they're not alone, but also to raise awareness of the issue, make it a more common thing to speak about. I think resources for people to know what to say, compassionate communication. I heard earlier about grief literacy. It's so important because most people don't mean to cause harm. I know professionals and family members, but there are a lot of misperceptions about pregnancy and infant loss that then add to the harm that can be caused by something somebody says.
And I think too, just looking at that stat of 25%, I mean, that's pretty high. And
it's 1 out of 2.
Sure. So I mean, and it affects everybody, right? Yeah. And how they deal with that and how they process that information. I was also alarmed with the stat of 1 in 5 having suicidal thoughts. That is...
And actually, we've known in our practice women who have committed suicide.
Yeah.
And they just go back home, and there's no support, there's no structure, or if there is, it's very unequal in different parts of the provinces, provinces. So in one province,
even if you're
you might
rural
have
or
support.
Rural or remote versus urban, that all matters.
Exactly.
Your access to services, for sure.
Exactly. And your husband's back at work. He looks like everything's fine with him, and you're all alone at home, and you're kind of ruminating about your loss, and you're getting support that's not really adequate to what you need. So we've known women who have committed suicide.
Well, thank you for the work that you both are doing. It's important.
Okay.
Time's up.
Madame Desrochers pour 6 minutes.
For 6 minutes, please. Thank you, Mr. Chair.
Peut-être commencer par...
I'll start by thanking the witnesses who are here with us. You talked about your experiences, your expertise, your knowledge. We heard very difficult testimony in connection to this very important bill.
Reiterate our commitment to make this bill move quickly. All members on this committee are prioritizing this bill because we know it's important for grieving parents. There's commitment in Budget 2025 for funding for benefits for grieving parents. So, this illustrates that we are serious about moving this forward. This is why we really need to move this bill out of committee back to the House so it could get the next step. This is a very personal issue for me. In 2017, my best friend's son, who was 9-year-old, who was also my son's best friend, died of a tragic soccer accident. And both of my friends just checked out. They were not able, and I had to step in, and I had to be the person to talk to the employers, to do the administrative issues to even do the funeral arrangement and they had no family nearby. I also lived through 2 miscarriages, so I know very well how grief is not linear. And everything that you mentioned, Ms. Faulkner, about even when you return to work, people, because I continue to support and accompany my friend since 2017, and everyone is tiptoeing around you, and there's some people who are like always afraid that you're gonna break out and cry at any moment. There are people who are just wishing you would move on, right? Because it's been long enough now. By now, you should have had all the time to grieve. And people just don't know how to handle grief. And I think to all your point about advocacy and education around it, I think it's really important. I think this is something that we should be working on.
In the previous panel, we talked about grief, it not being a linear experience. So I was wondering if you could comment on that. Should we consider a more flexible approach that would allow parents greater flexibility, give them, because right now what they're being told is that you have a certain period of time, you grieve, and then you come back to work. But we know that there are moments, it's not linear, that it's more difficult for parents sometimes. Sometimes we don't know why, they don't know why. Would there be an advantage to having more flexibility so that the benefits are not linear? That's my first question to both of you. Certainly, it would take a more flexible leave. For some parents, it's good for them to go back to work because it puts them back in touch with life. But for some, they try that, it doesn't work, they crumble, they go back to leave. I had a father who was on leave for 2 months and who I asked for an extension, but the doctor refused it, saying that your employer will not like this. And this father actually shared his experience in a documentary, and he was saying, I'm going to take off the Halloween decorations. It's late November. He goes on to do that, and he falls and breaks a leg, and then he will have to be on. He has to be on leave for 6 weeks. So, for a broken heart, he was not given that option, but for a broken leg, he ended up taking leave. So, when enough attention is not paid, it turns into other problems, physical problems or unidentified disorders, and when you dig deep, you see that there is grief or bereavement behind it all. I have a friend, for instance, who lost their father. The father was cremated, and then she had a significant car crash as she was driving back. She's alive, she was lucky, but grief makes it so that you have brain fog, like with COVID. It's the same thing. We're no longer the same people. We no longer have the same faculties. So we need flexibility because, yes, for people who want to go back to work, great. Who want to come back part-time, and I can do the morning, but in the afternoon I cannot, sure. And others will need 6 months off. So it's really case by case. During the pandemic, people were telling us, well, remote work helps because when I work, but I don't feel well and I feel like crying, no one realizes, no one sees that. I can go cry, come back to work, and I don't need to explain myself. I don't need to face people's gestures of sympathy without knowing what to say in return. Yes, flexibility has to be the guiding principle. We've been talking about this since 2018. The legislation already leads us to think in these terms. In Quebec, We are negotiating with the different political parties and with the government to raise awareness and telling them, look, the federal government is doing things you need to follow. So it already gives us some power in the provinces to make progress in this file.
Okay. Madame LaRouche for 6 minutes, please.
Merci beaucoup, Madame.
Thank you very much, Madam Chair. Now, we've had a number of meetings on this bill with very emotional testimony. In your case, you're talking to us from a position of experience as a researcher. It's quite interesting for us to think about the different aspects of this bill. Now, I'll start with Ms. de Montigny. My first question is the following. The bill is necessary, it's something we want, but it will take a royal recommendation. Unfortunately, it boils down to a money issue. We will have to convince the government to go ahead with this royal recommendation. And you talked about the impact of grief and of not taking action with this bill. You talked about negative consequences of being there and not being there, injuries. Yes, there is brain fog, and it could be a physical injury, but there could also be other psychological impacts. So could you really drive home the message around the financial question? It's not really an expenditure, but rather an investment, and in collective terms, the cost will be much smaller of doing this, of proceeding with this prevention. In our studies, we saw that women who had miscarriages, because they were not being supported in their community, for instance, with Pale Network, they were going to the emergency 4 to 5 times for the same miscarriage. So the cost associated with that, going to the emergency services, going to see a physician, it's significant. And because the family is experiencing the stress, they also need psychological services. That has a cost. And then you have children who have depressive and anxious disorders and behavioral issues. Then, well, you need to reach out to experts and specialists to get help, because this is something they will carry for the rest of their lives. And they transmit that to their children. Anxiety of mothers during pregnancy is transferred to the babies, which will then be transferred to the following generation. So we're talking about intergenerational transmission of mental health problems. It's very important. So parents should be allowed to live their grief properly. And when you have separation between the parents, that also has an impact on the family, a social impact. The family ends up having fewer resources. So it's all about taking preventive action for 100,000 Canadian families. The cost is very limited, and calculations were made in Quebec. They did not go faster with the initiative, but they did some calculations, and the cost of the leave was found to be more lower than not doing anything, and the costs of other services that would then be required. So then there is a positive impact of the Quebec Parental Insurance Plan, and there's research demonstrating that this is indeed the case. You talked about the person who lives the grief, but you have the other parent, the spouse. They are also impacted. Do you think that the bill is addressing the situation of the spouse or the other parent? I think paid grief leave is even more important for fathers or co-parents or the other parent in any case, because often there's no physical recovery, but there's emotional recovery, and they should be available to support their partners, and they should have the option of doing so. it's hard for men to be absent from work, socially speaking, how it will be perceived within the company. But the federal government is saying, in this case, will be, well, this is allowed. This is something we value. And having a certain number of weeks of leave will give them a break. When there is a pan-Canadian movement, a countrywide initiative, it will make it a lot easier for the individuals. Beyond the financial aspect, which we talked quite a bit about since the beginning of this panel, it boils down to application and also taking into consideration the co-parent, the father, for instance, and reducing paperwork and removing the financial stress so that people do not have to deal with additional stress in an already very challenging moment. I have about 30 seconds left. What could, beyond this bill, what types of services could be financed and could be provided to support parents? Well, I was talking about an awareness-raising campaign, and also we could talk about training that the PALE Network is offering, and these are also offered virtually in all regions of Ontario, that we're also starting to develop for Quebec. Having help services, support services virtually or physically from healthcare professionals would be great. Of course, they need to have the skills and the training to deal with parents because perinatal grief doesn't end with the first incident. It carries into the the following pregnancy because when a woman is pregnant again, it creates additional anxiety. They have questions about how it will all end.
Madame LaRouche. Now we'll go to Ms. Goodrich for 5 minutes, please.
Thank you, Ms. Chair, and thank you to our witnesses for being here today. And thank you for the work that you guys are doing. I think this is so important in terms of having these conversations so that we can bring light to this. My grandma used to always say sunshine was the best disinfectant, and I really do think having conversations like this helps people realize that they're not alone. And I've never experienced a pregnancy loss, but I have experienced the loss of both of my parents, and grief is messy, and grief isn't the same with each loss. Like when I lost my mom at 21, that was a very different space and feeling than when I lost my dad. As a much older, more responsible adult at 35. Like, similar feelings, but very different experience. And so I can only imagine that this becomes very different depending on the parent and depending on all these pieces. And we're hearing very clearly, especially in today's testimony, that this is something that is absolutely, this legislation is absolutely needed. And so, Ms. Faulkner, you've probably heard a little bit about this up to this point, but it's become clear that the only way this legislation can go forward, because it does exert the government having to spend money, the government will have to require a royal recommendation. And the opposition can want it as much as they want, the House can want it as much as they want, but realistically it lies to the cabinet to make that decision as to whether they will get the royal recommendation. And so would you recommend that this bill get a royal recommendation?
Yes, I do. We've heard a lot how important it is for families. It's also important for the healthcare community, for professionals and employers who are working in the space and dealing with the human impact of loss and trying to make it better. Having the royal recommendation and support for families would be really, really important.
So you've touched on something that is fairly new in this space of how it would impact the healthcare workers. And I know I used to sit on the health committee and we heard a lot about burnout in health. How would this bill help healthcare workers?
So we've been talking a little bit about the pervasive impact of pregnancy and infant loss and how it obviously impacts the family. And at PALE Network, we provide peer support as one of the big pillars of what we do. And we have that for the person who gave birth, partners, grandparents. We have a parenting after loss group because we know the the impact of loss continues throughout life. It also impacts people who come into contact with families, professionals, and service providers. And as I said earlier, everyone is wanting to do their best and help the family, but when you know that they're going to come up against a barrier, for example, having to go in person to Service Canada or have their parental leave ended and have to switch over and go through that process, there's a very real impact as well. We hear a lot from professionals that when there aren't the resources that they wish they were there to give to a family, there's an impact on them as well, feeling like you're just sending the family home without supports and resources, which obviously doesn't feel very good. And so I think it's so important to talk about this bill passing and the impact on families, as well as the social cost and the cost of it on systems as well. And I think it is an investment to pass this bill and to develop resources, education, support, and training for everyone who comes into contact with families, including professionals and health professionals.
No, I thank you. I really appreciate this. Et Madame de Montigny.
Ms. de Montigny, when there is a loss during pregnancy, are there supports for the father? I didn't really understand your question. If the father loses the child, you want to say? If the father loses their wife during pregnancy. I mean, it's rare that women die at childbirth, but it can happen. It has happened to fathers in Quebec where both the mother and the baby died, and this was about 10 years ago, this particular case, and the father was refused access to leave. He was grieving, of course, for both losses. Now, healthcare professionals feel powerless when they have parents who have to go back to work but who don't feel ready or capable to do so, and the professionals don't know how to help them. And the bill, C-222, will also make sure that the ripple effect is known. It's about grief literacy. Everyone, healthcare professionals, extended family, other family members.
Means going through a perinatal death, going through grief, and knowing that it's okay to ask, are you okay? And it's okay the other parent answers, I'm not okay.
Thank you very much. For our next round, Mr. Joseph for 5.
Merci, Madame la Présidente.
Thank you, Madam Chair. I would like to highlight the courage of our witnesses. Ms. Faulkner, the government, I would like to assure you, the government is really determined to move this bill forward and ensure its adoption and getting the royal recommendation. I have a question for Ms. de Montigny. For Francine, you have 30 years of experience. It's really extraordinary. Do you think that it's always been an uphill battle over these 30 years against governments? And do you think that this bill will put an end to this struggle, which I think is 100% legitimate? Well, maybe it will not end it, but it will be a step in the right direction. And hopefully before my retirement. But over these 30 years, in the last 5 maybe, we have been talking about perinatal death a lot more. Megan talked about October 15th, the awareness-raising campaign. It highlights the cases of parents. But it doesn't only happen on October 15th. We have perinatal grief and deaths every day. And these parents end up in a system that they did not expect to be in. So they have to fight every step of the way with the different plans, with their employers, with the forms they need to fill out. So this will help them out. This will make it easier for them. And when we organize training sessions, people say, what I experienced was horrible, but I was really supported well. So this bill will help parents. Hopefully they will be able to say, I mean, it was horrible what I experienced, but I was lucky that it happened in Canada because there were options and services and supports available. You talked about collaboration with the provinces. Do you think that there are challenges between the provinces and the federal government as we speak? Well, it's not documented in the same way in all provinces. The statistics are very hard to get. We need to start working from the number of deaths because some focus on 20 weeks, 24 weeks, or other numbers of weeks. So, and it's not visible. So that's a primary challenge. The scientific knowledge we have tells us maybe a miscarriage, there is 1 out of every 4 or 5 pregnancies, but sometimes women don't even go see a physician, so that's not then captured. The federal government's position is putting pressure on the provincial government, for instance, in Quebec, because they see what's happening at the federal level. They need to sometimes follow or sometimes take the lead, and that's good. It forces them to think about this. The 3 political parties are aware that something needs to be done, so they're watching the federal government. So if this goes ahead, it will have a ripple effect across Canada. Now, one last question, a more general question about public policy. We have a role. What is this role in your opinion? Do you have recommendations or any kind of advice for us? Because given your experience, your recommendations will be really welcome. Well, it's a big question you're asking.
Je vais peut-être passer la question à Madame Megan.
I could ask the question to Ms. Faulkner too, yeah.
A big question, maybe you can share it. Yeah, thank you. Thank you for the question. I think you've heard amazing recommendations from speakers. At Pale Network, we encourage really focusing on listening to the voices of parents, following people who have lived experience of loss in their recommendations. We are so fortunate that often families are very generous. There's amazing literature, which I'd be happy to share, that has surveys of hundreds, thousands of families who have said what is important to them at the time of their pregnancy, infant loss. And so I think listening to the voices of bereaved parents, I think, is really, really important in informing policy. I think having a federal approach to addressing pregnancy and infant loss in general would be really, really important. And this bill is a very strong message to families that this type of loss matters and that their baby matters and that they don't need to grieve alone. I think
Thank you, Ms. Faulkner.
Thank you.
Madame LaRoche for 2.5 minutes, please.
Merci beaucoup.
Thank you very much, Madam Chair. Thank you very much, Francine de Montigny, for having turned your experience into the battle of your lifetime. As Ms. Meunier was saying, in Quebec, the QPIP has a period of 18 weeks. That sent a message for the federal government, I think, to go ahead and find a solution to help these families even more. Now, to wrap my last turn up, Ms. Faulkner, now, in your admirable work, you seem to be advocating for a more comprehensive reform, but when it comes to their interactions with the EI system and the complex administrative steps, what's your experience with the parents?
We've heard from several of our Pale Network volunteers and families of the impact of bureaucracy. We know that when people are grieving, it feels very difficult to reach out for supports or resources. And so trying to navigate these systems is challenging. I think we also have heard that professionals might not know exactly what to share, or employers might not know what to share. And so the guidance that families receive can be very limited or incorrect. And so their experience is trying to navigate that, searching, Googling, trying to figure out what they're eligible for or not, listening to stories from other people and going on Facebook or, social media and trying to find what worked for others. And so the impact of that bureaucracy while they're grieving, while they're dealing with health issues sometimes, trying to honor their babies, the impact of bureaucracy and going in person and sharing your story over and over again to people who, in general, might be compassionate or not. We hear a lot not. I think this is the experience of families that we hear often.
Rapidement, est-ce que le système de...
Well, quickly, an automatic support could it lessen the administrative burden on the parents if it kicks in automatically this benefit?
Sorry, I couldn't. My volume maybe.
She said, will it? Est-ce que vous entendez?
Oh, I didn't turn my mic.
Can you hear the interpretation now? Can you hear me now? Okay, I'll repeat my question 10 seconds quickly. To help grieving parents to reduce the administrative burden on them, should the system be a unique application system or an automatic kick-in of the benefit? Is that something that could make it easier?
I would advocate automatic kick-in of the benefit with flexibility for the parent to choose if they want something different. I think any time you can remove the onus on a grieving family to reach out for support to change a system or a process, I think we should do that. I think that would be important.
Thank you very much. And now we will go to Mr. Reynolds for 5 minutes.
Thank you very much, Madam Chair, and thank you so much, witnesses, for coming here today. We've been hearing stories over a couple of meetings now, very heavy stories. I'm a father of 3 and a grandfather of 3, and I can't even imagine what these families are going through. And I want to say thank you so much for your work. Here on the committee, we hear these stories, and really it's a snapshot of what these families are truly going through, but you both are with these families from start to finish, and I'd like to thank you so much for your work. You must be feeling all of it. It's even hard for us in the committee. It's been a very emotional committee meeting today, and I'm sure you guys carry this with you all the time. So thank you so much for your work. Thank you for coming here today and sharing with us. Your input is so important to this work. So my first question I want to ask Ms. Faulkner, can you share with us, in your experience, what a typical recovery time is for families? Just obviously it's so different and for individuals, but just on average, when are people sort of feeling ready to face the world again?
Yeah, it's an amazing question, thank you, and also a very challenging one to answer. I would say that when, for a lot of people, when they discover that they're pregnant or when they've given birth to their baby, they envision their future with that baby, and they envision often the amount of time that they've planned off work, they've prepared for that, and so when a baby dies and everything sort of changes, the feeling of going back to work right away is very, very challenging. The circumstances of loss vary so greatly, and some people anticipate it coming. Others, it's a complete shock, and so sometimes those circumstances impact the amount of time a person might want off or leave. I would say that there's this is probably not the answer that you want, but there's no, I think, typical timeline for a family, for a person. It will be dependent on culture and beliefs and even their grieving style. We know that for some people, returning to work is protective or healthy and something that people will want to do, and I think that should be supported, which is why we're talking a little bit about flexibility. And for other people, they might never return to work, and then everybody's kind of in between. I would say that we hear from most families that no time or a few weeks is not enough, and so I think families would probably say they need more than that, but a typical time is challenging. I think for a lot of families, the practicalities of considering a subsequent pregnancy, a future baby, needing to get back to work to accumulate time so that you qualify for leave again is a practical consideration. We know that after loss, approximately 80% of families are pregnant within 1 to 2 years. And so I would say in that time frame, people who want to qualify again for a pregnancy leave, parental leave, will return to work in that time frame to accumulate their hours. If they felt supported at the time of their loss, were given resources and met people who had education and training on compassionate care, they're more prepared to re-enter typical life after and to continue to integrate this loss into the rest of their life.
Do you feel that our current structure for bereavement is long enough?
We've heard from so many families that the answer is no. I don't think so either. I think that a lot of people are required to return to work or required to enter into a process that becomes complicated or burdensome, and so they don't. So no, I would say it's not long enough. This is what the bill can change.
With this bill, in your opinion, are we dotting all the I's, crossing all the T's? Are we missing anything? Is anybody going to slip through the cracks, I guess, is essentially what I'm asking?
I think that the bill addresses a lot of concerns that families have. There's nothing that comes to mind for me that's glaring.
Thank you, Mr. Reynolds. For our final round, we will go to Madame Koutrakis for 5 minutes, please.
Thank you, Madam Chair, and thank you to our witnesses for appearing here today. And thank you, I have to echo a lot of the comments of my colleague, Mr. Reynolds, to thank you and all the witnesses that appeared before us today, and the researchers and the professional work that you do to help us better understand as legislators where we need to focus more and to do better, but also to, pass the message on to grieving parents that they have been heard. It is time to get this bill passed. It's been quite a few years. In the previous meeting, we heard parents that have been working on this for at least 10 years following, the death of their child. And before that, I've heard stories since the 1990s. So I think we can all agree here at this committee that all the members are prioritizing this bill. As a government, we ensured to include funding for grieving parents to ensure that there will be no stumbling block, where funding is concerned. And this is why we need to move it out of committee as quickly as possible to get it back to the House and to make sure that it becomes law, Evans Law. For the balance of my time, I would like to give each of you an opportunity to provide us with some closing remarks, some final thoughts that you think we haven't touched upon and that you think would be relevant to include in our report, in this testimony, that would benefit all of us. So s'il vous plaît, Madame de Montigny, je vais commencer avec vous.
Ms. de Montigny, if we can start with you. Well, you're right. It's been a long time. I was involved in 2 petitions in Quebec for parental leave. I think the first one is 2012. So it's been a long time coming. And Mr. Reynolds referred to this as well. I've been working with groups of parents for more than 20 years. Every single time I see the grief, the work that they're doing to get better, to feel better. And there are, of course, anniversaries or other moments which could bring everything back and lead to more intense grief. So I think this bill is sending a clear message to all of Canada, to the provinces, and even an international message, because I'm a member of International Stillbirth Alliance. I was on the executive committee for 7 years. We have seen little progress. It's moving slowly. A country comes up with a week, another country goes for 2 weeks, another country says 3 weeks of leave. So countries look to each other, and have been in an avant-garde situation or position, if you will, in Canada. Australia and the UK are other similar examples. Some other countries are not the same. For instance, India, perinatal leave, it doesn't exist. I mean, the mother comes back to the home, everything is removed from the child's room as if they did not even exist. So this will be an international example. Canada will be shown as an example to others. On the economic front, social front, for what it does for parents, and at the international level, this is something, a good example.
Add your closing remarks?
Yes, thank you. I think first, parents are really excited about this. I know personally people watching today who have been working on this, as you said, and advocating for this change. And so I hope you hear that message that this is something families are really excited about, seeing a change. I think as well, as Francine is saying, the opportunity for leadership internationally, but also nationally, is so important. And this bill is an example of that, and hopefully not the end. I think that in addition to the passing of this bill, consideration around its implementation and how we can better wrap care around families in general is really important. And there are so many people across the country and organizations doing amazing work. There's not a lot of coordination or support, and I think a national approach to education and resources and advocacy for families would make a really big difference. And I think there's an opportunity to include that with this bill, some elements of that.
Thank you, Madame Koutrakis, and I'd like to thank our witnesses for coming today and sharing their testimony. Our next meeting will be on Monday, March 23rd, 2026, when we will resume the study on Bill C-222. Is it the will of the committee to adjourn? Oh my